Okay, can we start with you, Brian? And just tell us a little bit about your own background, the work that you did during your working life, and then moving to the work that you're now involved with in terms of this fight against the COVID-19.
Sure. Thank you, Jude. And greetings to everybody in Ireland. I know you're fighting the same fight as we are. This is truly a global issue, and we doing our little bit we can by mobilizing the Irish American community. Myself, Brian McCABE, with a long history in this. My professional career prior was with the NYPD for many years, where I was in the Detective Bureau, and I primarily I had ended my career and had been a number of years in the Manhattan South Homicide Squad. As well as being responsible for providing security to our leaders during the initiation of the peace process and all the way through. So there's a great irony. I had said now, having been involved in homicide work during one of the most violent periods in New York City's history. And then I retired from the NYPD, and I took what I thought would be a kind of a step down and I got into healthcare, providing safety and security programs at a number of hospitals. So after going from that into this experience, and now I find myself in the midst of a global pandemic, it kind of circled right back round again. But
so what exactly is the work that you're doing and that the McLAUGHLIN group are doing?
Well, thank you. That's what we'd prefer to concentrate on. And Jim will speak a little about the medical issues we're facing. But Jim and other friends of mine and colleagues, particularly a number of people, we had organized a METHL, the idea of our crowd helping others. Back in 2012, we had a very serious targeted effort to help those people who had been afflicted by the Hurricane Sandy, the superstorm Sandy, that had affected many of our crowd as well as just regional. And it wasn't specific to our crowd. It was just a way that we could mobilize the Irish and Irish Americans. So with a core group of colleagues who had worked on that METHL with me back in 2012, I thought of the idea of doing it again as we face this global pandemic. And with friends like Jim, Dr. Jim McLAUGHLIN, Dr. Neve Long, a young Irish doctor from Cork, and Kathy McAuliffe, a senior nurse. Mm-hmm. We had that aspect of it became part of the team, as well as my brother Gerard and Marty Glennon, staunch people from the legal side. So and we also got engaged with us a number of young, recently Irish, mostly GAA people. I think you've met Sophie when you were over.
That's right.
Yeah.
So what exactly are you doing, Brian? What exactly?
Okay, so we brought that team together as a way of kind of focusing our efforts. One of the problems here is that indeed you don't have the opportunity to get hands in that much. Everybody is kind of distance in their homes and with anxiety watching the TV. So we wanted a way to get our community to be able to do something proactive. It's our way. That's what we do. We want to get in the fray. We don't want things to just happen to us and unfold. Okay. So with this team we put together, we focused on the fact that many of our crowd are in the building trades and the trade unions and such. And as they were stood down because of the economy, we felt that there was a lot of equipment that was on the shelves there that they used.
Such as, for example?
Yeah, surgical masks or N95 masks, the gloves and cleaning products, things that could be easily adapted to support the frontline medical staff. So the plan was in the first phase to access that and distribute them to hospitals or healthcare people in need.
Very good. And how many people would be involved in that altogether?
Well, our core group was about a dozen people, but every day we're expanding more. We've had outreach to hundreds. We have a number of organizations, very good, fine organizations that represent a broad spectrum of our community that have come together under the banner of the METHL. and have helped us in both collection and distribution.
Okay. Jim, do you want to comment on that and how are you involved in it?
Sure. I'm a cardiologist in Orange County, New York, which is about an hour north of the city. And on a daily basis, I see patients in the hospital and even some that come into the office who are afflicted. New York is the epicenter of this COVID crisis right now. We're approaching and may pass 10,000 deaths today, which is a milestone we did not want to reach. Even in the last couple of weeks on the media, you see healthcare workers wearing garbage bags, for protection, and some of these people are getting sick, subsequently. So we're trying to provide or assist the government in, as best they can. No one predicted that, the scope of this crisis, and I think that we're helping provide the N95 masks, surgical gowns, gloves to these centers that really need it. Recently down at Elmhurst and Wyckoff, which were particularly hard hit, during the outset of this.
So how do you get the stuff to them? Does somebody come and leave them at a spot at the hospital and then the people pick it up, or?
We've had a couple of central locations, the Ashling Center in Yonkers and the New York Irish Center in Long Island City in Queens have allowed us space to store donations, and then we pick them up and deliver them from there to the hospital. Also, the padded wagon has been very helpful in storing equipment. Padded wagon is
yeah. Go ahead. What is that?
It's a moving and storage company that's Irish owned, that's helped us store and move some of the equipment as well.
And is it strictly Irish Americans are involved in this, or can anybody join?
Anybody certainly can join, and we encourage people to join. There are many groups who have mobilized, and we're developing actually a broader front to do so. And to Jim's point, we are very clear and very careful. We need to do this in a disciplined manner. We don't want to be part of the problem. We want to help with the solution. So we're practicing that social distancing. We are following all of the protocols necessary. So our colleagues in the New York Irish Center, in the Ashling Center, and our assistants from Emerald Dry Cleaners and the Padded Wagon Moving Company, they are all briefed on how best to protect themselves and how we targeted these locations for drop-offs. They do it appropriately. We identify and vet the types of equipment, and then we deliver them in large enough parcels to be helpful to specific hospitals that might have that need.
That's very impressive, very impressive. And it's absolutely wonderful to hear of the Irish American community, springing into action so smoothly and so effectively. But could I ask, what would you think, Jim? Should hospitals not have the proper equipment? Why should it be left to people like yourselves to engage in this very worthwhile effort? But are the hospitals not as supplied as they should be?
No one expected the scope, the numbers of corona cases. New York has, had just a large amount of, all at once, of people in the hospitals. The hospitals have been jammed. And unfortunately, too, the morgues have been jammed in the hospitals. 10,000 deaths in such a short period of time from this one illness is, definitely overwhelms any system, and very hard to, prepare for a pandemic like this.
I've seen criticism on television suggesting that President Trump for some time was saying, well, it wasn't really very important, and it would all sort of fade once you got to the decent weather and so on. Do you feel that the government was moving as smartly as it might have, or moving as swiftly as you guys obviously have?
Yeah, I mean, I think that closing the flights to China at the end of January was a positive thing. I think moving in the ventilators to New York when they asked for them, and the naval ship, the medical ship and then restructuring the Javits Center to a 1,000-bed hospital was very important. But I think that for the future, we haven't had a pandemic like this in 100 years. Getting the necessary equipment to be prepared for pandemic in the future will be definitely something we'll need to do.
Jim, are you actually working with COVID-19 people, or are you doing your own work and doing this effort as well?
Well, there's two ways. I see patients in the hospital who are COVID positive. There's a lot of cardiac manifestations of coronavirus. There are cardiomyopathies, there are arrhythmias like atrial fibrillation. So we're commonly called to see them. And in intensive care unit, we commonly are called to see critically ill people. We also have a COVID response team where I work at Crystal Healthcare that is on a voluntary basis, but as a backup to support local hospitals. But even some of our docs go down to the Bronx, about an hour away, to support them, which is kind of a large hospital system.
Are you afraid?
Well, I think anyone in healthcare is afraid at this point. For one thing, you don't want to catch it yourself, which is probably pretty minimal for most people. But you don't want to be a vector of disease to your sick patients and cause them to potentially harm them, and you don't want to bring it home to your family. So you're probably more afraid of giving it to someone or being a vector than actually getting it yourself.
Yeah. Brian, are you afraid?
No, I not in the sense of one of the things I think we really need to deal with is the anxiety that comes along anytime a situation like this occurs. There are risks involved, and so we have to follow those protocols. We need to be disciplined about it. Am I concerned about the potential? Yes, I am. I wouldn't describe it as a fear. I recognize the risk. We take the proactive steps to try to take protective steps for ourselves. We discipline our teams so that we do not be vectors or be able to spread this. And I think that the educated, necessary use of prophylactic means of preventing will seriously minimize the risk. The problem is among people who do not recognize the risk, and then they become community-based vectors of this disease by not following the dictates of social distancing, wearing masks and such. As a professional, and knowing the risks and accepting them to a degree, and taking the appropriate steps to mitigate risk, you can't live in fear. Fear stops people from doing what needs to be done. Mm-hmm. What you need to do is recognize them, prevent them, and then do the good job.
Uh-huh. How are you managing, Jim, with the lockdown? You're obviously going to work. Are your family finding it hard to be confined to quarters?
Well, they have their school going online, so they're getting accustomed to that. The kids are doing well.
The same though, you can't goof around the back row whenever you're at home and online. And do they miss their friends?
Exactly. So they'll do the online chatting and the online school, and they're kind of focused on their studies. My wife is at times can get a little bit stir crazy, what we call it, but it's something we just have to kind of go through. I have a son with special needs, and I'm kind of concerned about him that he had asthma as a child, and if he were to contract it, he would be very sick. So, we're just all all pitch in for the right reason. Yeah.
Are your children frightened?
No, they're actually they're kind of accepting of it, and we've explained it to them. As long as you talk to them, and the reasons that we have to do this, they're really not kind of pushing to get out.
Yeah, Brian, are you going stir crazy?
I'm not. I mean, I'm
not
home. I'm not home much, and but my two, the young ones I have at home, is a particularly poignant reason. My daughter, I have a 14-year-old daughter who would be graduating grammar school this year, or this spring, this June, and I have a 17 going on 18-year-old son who's a high school senior, and he would be graduating. And aside from the risk of being afflicted by this, there are emotional concerns with kids at that age. Their senior season is done. The proms are done. He can't see his girlfriend. She can't see her friends. But they all understand it in a way that I'm very proud of. They accept it as the new normal, which is laudable. But at the same time, when it is done, we're going to have to really do something special for them as they've soldiered through this. They have been doing their online classes. They're doing quite well. They haven't been at each other's throats. So they're doing, we're doing all right. And we will continue to do all right. One of the things behind this very quickly, Jude, again, is Jim and I, we have to be out in this. Many of our people cannot be. They have to be home with their kids, or they have to be home with themselves. And part of the idea of the Methel was an opportunity for us to deliver on the ground, but we also have fundraising involved. We have some creative things going on, and we want to be able to provide our crowd, who usually steps in to do physical work, to be able to use this modern technology and our instant availability to link arms through the social media and be able to contribute while at home. We can be socially distanced, but we don't need to be socially isolated, and we still are a community that works together.
Well, okay, a final question to both of you. When do you think this will be over? When do you think life will begin to return to normal in New York?
Go ahead, Doc.
Well, I think we're at the kind of approaching the peak. Hopefully, we're going to see a plateau pretty soon. And we're still getting more than 700 deaths per day in New York. Kind of like between 700 and 800 per day. But we are seeing less people admitted to the hospital. We're seeing less people admitted to the intensive care unit. Actually, our COVID response team is kind of slowing down slightly at this point, which is all promising. But just people have to do the right thing. We don't need another spike in this. If everyone gets too complacent, we could really see it take off again.
Well, I just end with reference to Brian's 3-minute video he did on the Methel. Can you tell us what site people can go to find out more about the work you're doing, Brian?
Yes, there's a Facebook site called the Methel. It's called Irish America in Support of Healthcare. There is also an email address that is themethel, MEITHEAL.com, where they could send, themethel@gmail.com, where they could send inquiries, or if they're looking for direction, and that'll be handled. Sophie is doing our communications, and so we have a lot of people intertwined in making this work. Facebook, social media, themethel@gmail.com. And through good people like yourself getting the word out. Greatly appreciated, Jude.
Well, you seem to be doing a sterling job. And I was particularly impressed by that video, but the way you ended it when you spoke about the fact that in the summer, there'll be better days ahead.
Yeah, we'll see this through. Like any crisis, there will be an end, and there'll be a reckoning, and we can deal with all of those issues now, the political ones, the lack of preparation or not. What we need to now is to recognize the common enemy, put aside differences, and fight through this until we're done. Jim made a very, very good point that I'm very concerned of, particularly with the American side of this. That everybody is just chomping at the bit. They think rules sometimes don't apply to them. They want their personal freedoms. And look, even as things plateau, or flatten the curve, as we were being requested to do, as the numbers start improving, that doesn't mean this is gone. Complacency cannot cause another surge. We've seen this happen in other areas of the world. Hong Kong was very proud of the fact that they, compared to the rest of China, were very minimal initially, but then they had a second surge. We have to guard against that, guard against complacency, keep the eyes on the goal, and we'll work through this to the end.
Very good. Thank you both very much for doing inspirational work. And we'll talk again, I hope, in better days. Thanks, Brian. Thanks, Jim.
Absolutely. Thank
Thanks,
you,
Jim.
Jude.
Take care.
Thanks, Jim.
Okay.
And thanks to the Metal team. All those people have done some phenomenal work. I want to
Indeed.
thank all of the people involved in our team
Okay.
and those people who support us.
Slán,
Take care.
slán
Right.
agus